welcome to Beyond the Knife, a medical history podcast brought to you by Surgeons Hall, Museums, Library and Archives. We are part of the Royal College of Surgeons of Edinburgh. I am Chanté, Director of Heritage and Estates at the college. Each episode, I'm joined by a guest who shares a story from the history of medicine and surgery. This episode contains discussions on topics that some people may find distressing. Please take care while listening. Throughout history, disease doesn't just shape our health, it influences culture, science, and society itself. And few illnesses illustrate this better than syphilis. In this Valentine's Day episode, I'm joined by Human Remains Conservator Kat Irving as we explore the long and often awkward history of syphilis. From its earliest recorded outbreaks to the way it transformed medical knowledge, public health, and social attitudes. We'll look at how it was understood, misunderstood, diagnosed, misdiagnosed, and how fear, morality, and stigma often traveled hand in hand with this disease. And while syphilis is often thought of as a problem of the past, it hasn't gone away. In recent years, cases have been rising, a timely reminder that the history of disease doesn't stay in the history books, even on the most romantic day of the year. Kat, welcome to the podcast.
Hello, it's lovely to speak to you again.
Yes, you are of course back. This might even be your third episode with us.
This is my third episode, yeah.
Okay, so we're going to talk about one of the moments you could have been present at the history of medicine and what that would be. So the first moment that you shared with us, I think, was being there when Vesalius articulated the skeleton of a man.
Yes, so that is definitely something I would have liked to have seen. But we're going to talk about syphilis today. And one of the things about syphilis is that it's a venereal disease, and people would say that you'd spend one night with Venus and a lifetime with Mercury. And we're going to talk later on about why Mercury is so important in syphilis. But basically, I think if I could go back in time to do with syphilis, it would be to tell people, maybe don't use Mercury.
Wow. So venereal comes from Venus?
Venereal, Venus, same thing. So it's to do with sex. Venus was the goddess of sex and love. So it was a disease that was known to be spread through sexual contact.
And of course, we are coming up to Valentine's Day. So what a perfect time to talk about this.
Absolutely. You know, try not to get syphilis for Valentine's Day.
So, Kat, tell us, what is syphilis?
Well, as we said, it's a sexually transmitted disease. It's spread by a bacteria, and the bacteria is called Treponema pallidum, and it's called a spirochete bacteria, and that's because it's shaped like a little spiral. So when you see it, when you see electron micrographs of it, it actually looks quite cute. It's quite a nice looking thing, but it has terrible consequences on the body. And one of the things that we see in our collection here at Surgeons Hall is some of those consequences. So we have skulls which have holes in them, effectively, you know, ulcers that have gone right through the outer table of the skull so that the brain would be exposed. We have palates that have been degraded, so people would have holes in the top of their mouths. We have these terribly thickened bones. We have these things called gummas, which are like large lumps in various tissues. So it's really, really a terribly destructive disease. But it starts off with something that's actually quite small. You know, you do what you do with someone and you get what's known as a chancre. And a chancre is basically a small ulcer, and you get that wherever the bacteria has gone into your body. So it might be the penis, the vagina, the anus, the mouth. It's where the bacteria is actually going in. It's just a small ulcer. It lasts a few weeks. Depending on where it is, you know, you imagine if it's on your cervix or your vagina, you might not even see it or notice it. It might be something that goes completely unremarked, but it will go away. Doesn't seem too bad. And then a couple of weeks later, you'll start getting other symptoms, cold and flu-like symptoms, a rash, pains in your bones, various things like that. And syphilis was sometimes known as the great imitator, because it could look like a lot of other things. And then those symptoms would pass as well. You'd be ill for a couple of weeks, maybe a few months, and then you'd get better, or you'd think you did. But then you were going into a latent phase. And effectively, that's when that spirochete is going underground in your body. It's going deep into your tissue. And then maybe a year later, maybe 20 years later, that's when you get into what's known as tertiary syphilis. And that's where you start to get these massive destruction of parts of the body. We're talking about Valentine's Day, it would often get into the heart and the aorta. Sometimes that would just burst and rupture, causing you to immediately die. It might get into the nervous system, causing terrible problems in there. Or you might get these really destructive gumma that would start eating away at the skull, destroying often the nose. It seemed to really like that area of the face, and cause terrible lesions on the body.
I have questions.
Yeah.
So Gummer?
It's gumma. This is known as gummatous syphilis. So you would get these, you might think it looks like a tumor, a lump, but it's not cancerous. It's not malignant. It's not going to spread to other tissues in the way cancer would. But it can erode what's underneath. So you might have one on, it gets into connective tissue. So, things like the bones, the membranes, things like that. And it can actually degrade the tissue that's underneath, leading to ulceration and sores.
And so that's happening both inside the body and outside.
Yeah, it's happening on all these different connective tissues. So it can happen anywhere, really. But, obviously, if it's causing ulceration, we've got some examples where there's ulceration on the forehead. That's when it's going to be noticeable. That's when people are going to comment in the street, for example.
Okay. And the heart bursting?
Yeah, that's due to if it's got into the cardiovascular system. So syphilis seems to particularly like the aorta just coming out of the heart. So often that would lead to an aneurysm, and then that could burst, and that can lead to death very, very, very quickly.
And this is all the spirochete bacteria that's just having a great time.
It's just getting into the body, having a good old party, and causing a lot of problems.
And that period of lying latent is fascinating.
Yeah. And that's it. And for a long time they thought, you'd gotten over it. So for some young men, they might lose their virginity, get syphilis, and then they get the pox, they get the chancre, they get the rash, and then you've beaten syphilis. It might be like a rite of passage. And for a long time, they didn't realize that it was actually then causing these problems further down the line.
So when do we first hear about cases of syphilis coming about?
So the first known outbreak of syphilis in Europe was in 1494. It spread very, very, very rapidly after that, all across Europe. Within a few years, it's here in Scotland, but it gets everywhere.
1494. So the ability to diagnose at that time.
Yeah.
Something that was so varied and operated in such a difficult way.
Yeah. And there are a whole range of theories about syphilis in 1494, whether it was a new disease, like something, again, like COVID that's evolved and suddenly it has this massive effect, or whether it was, there's a whole theory that it was brought over from the Americas with Columbus. Again, we're starting to maybe see evidence that there was some syphilis in Europe prior to that. But whatever happened, whether it's evolved into a new form of the disease or whether or not it's an entirely new disease that's been brought from somewhere else, at that point in 1494, there's a really different reaction. People are suddenly, they've never seen this form of the disease before. Their immune systems are going into overdrive. It was actually at the siege of Naples where you got the first outbreak. And there were reports then that you could hear people screaming in the streets as this disease was getting into their system.
Gosh, okay. So we are sitting here in Edinburgh. It is the start of the year, so it is very deepest, darkest Edinburgh, feels like at the moment.
Yeah.
What would it have been like here in terms of syphilis? When did syphilis really strike Edinburgh?
Well, there are actually reports in the 1490s of James IV of Scotland getting people with syphilis to go to a beach in Leith and say, we're going to take you to an island in the Forth. I'm going to leave you there so that we're not spreading this disease.
He quarantined provoked people?
Yeah.
Did it work? No.
Well, it still spread. You're not getting everyone. But in Scotland, it was called the Grand Gore. It's really interesting because obviously we call it syphilis today. But at that point, it was known as, if you were French, you called it the Italian pox. And if you were Italian, you called it the French pox.
I think it's such an amazing example of, I guess, the opinions of different cultures at the time.
Yeah.
Who you didn't like at the time.
Yeah, that's who you blame it on.
And I think, did I read that it's actually named after an Italian shepherd or something?
There was a poem written about an Italian shepherd, and he pissed off the gods, and syphilis was his punishment, and his name had been Syphilis. So this was, in the 16th century that this poem was written. So this was where the name syphilis comes from.
Gosh, it's like a really dark Bob Dylan song. Okay, so in Edinburgh, we've got this documentation of James IV trying to quarantine people unsuccessfully. When did it kind of come to a real peak here?
Well, syphilis, the numbers grew and grew, and especially when you get urbanization, we really start to see it exploding. We don't know because there was no definitive diagnostic technique, but I've read reports that said that in London, it was as high as 1 in 4, 1 in 5 people had syphilis in the 19th century.
1 in 5 people in London. That is extraordinary.
And again, there's absolutely no way of verifying these numbers, but it gives you an idea of the scale of the problem, how people were thinking of it.
It's incredible. So if we would think about when Edinburgh starts to hit those peaks of urbanisation, let's say the 1800s, what's it like there?
It's really interesting when you get into Edinburgh in the 19th century because we start to get some, shall we say, blaming of women for this problem. I mean, it's always been going on, but this really starts to be codified. And we actually get what's known as a lock hospital. The lock hospital starts off at the Royal Infirmary as lock wards. So these were specifically wards for women who had venereal problems, specifically syphilis. And the first one was in the 1750s, attached to the Royal Infirmary. But in 1836, you actually get a lock hospital. So if you look at the maps of Edinburgh in the 1840s, you can actually see it. It's next to where Old Surgeons' Hall was, just between Old Surgeons' Hall and the remnants of the city wall. And it says Lock Hospital. And what is Old Surgeons' Hall was at that point a fever hospital because we'd moved to a lovely shiny building here on Nicholson Street. So that's where they would put women who were suspected of having a venereal disease. And as I said, it's the great imitator. Maybe you just had a different type of rash, that kind of thing. And it's called a lock hospital because they want you to stay in there.
So it's L-O-C-K lock.
L-O-C-K lock. And at this stage, it wasn't compulsory that you stayed there. The idea of a lock hospital, you think that you're actually locked inside it. You could leave, but if you did leave, you weren't allowed to come back, which meant you weren't going to get any further treatment. And there were also other things, like sometimes they would shave the women's hair in the lock hospital so that there would be a stigma attached if you did leave. So technically you could leave, but there were definitely things that would make you not want to do that.
So as a woman in the lock hospital, which sounds absolutely horrific, you're stigmatized if you leave. I mean, it must have been so horrifically unpleasant. What kind of, am I being treated?
Yes, there would be treatments. The most common treatment really from the early days was mercury. Mercury was first used to treat syphilis by a man who we have a portrait of here in the college. You might have seen it. It's of Philippus Aurelius Theophrastus Bombastus von Hohenheim.
It's an incredible
name. Thankfully, it's been shortened by history to Paracelsus.
I like that portrait. I did not know that this is what he was known for.
Yeah, well, he was a physician. He was also an alchemist. And he had theories about the tria prima. So this was the idea that, you had mercury, sulfur, and salt. And that the way these interacted was often responsible for diseases. And he also had this idea that the dose makes the poison. So anything will be poisonous in a high enough dose. And there is some factual basis in this. And he thought if you use something that was poisonous in very, very small amounts, that this could actually be a treatment. And so he started to use mercury, which is incredibly toxic to the body, as treatment. And many, many things have been tried for syphilis, but mercury was the one that really has stuck. So, you could get mercurous chloride, which would be used as an ointment. So, you could put that on the rashes. From the 17th century, you got mercury pills to take. There was also mercury fumigation. Ugh. Yeah, so you would literally be put in an apparatus with hot mercury underneath, which would produce vapors, which would steam your body.
So the idea is it was poisoning the disease out?
Yes, yeah. And even into the 19th century, there's a book written by Jonathan Green in 1852, which is called An Improved Mode of Employing Mercury by Fumigation to the Whole Body, exemplified by cases of its success in various syphilitic afflictions. And as I say, this is from 1852. So this is relatively recent. So this is being promoted at the time when these lock hospitals are in existence. And there were also things like mercury douches, which you would use to...
I'm putting my head in my hands at this point.
Yeah. So really, really horrific things, especially when you think that the symptoms of being exposed to mercury include things like rashes, and nausea, and having problems with various organs in your body. In extreme cases, it can make your hair and your teeth fall out. It can cause your kidneys to fail and even cause death. So, it's only slightly different to what you're actually trying to treat.
So definitely not a remedy.
Definitely not a remedy for treating syphilis. But this was what these women were being put through.
And I read as well that the other way of contracting syphilis is through birth?
Yes, yeah, it's something that can be passed from mother to child. And you've got to imagine that if you think about how destructive this is on an adult body, you know, the fact that it can cause such degradation to bones, all this kind of thing, imagine what that's doing to a developing child. So you can see a thing where you get thinning of the skull, teeth don't form properly. So there's this thing called Hutchinson's teeth, where the teeth would have these little notches in them. And again, it's because there wasn't opportunity for them to form properly. And it could lead to deafness and blindness in later life. So it had a horrible effect on anyone who had this passed from their mother.
Mm-hmm. And so what's happening to the men?
Well, this is interesting because we have the women in the lock hospitals. And another thing that's really interesting about the lock hospitals is that it actually gets put into law. We get the Contagious Diseases Act in 1864. And that means that women who are suspected of prostitution, I'm using the term of the time for it, could be forcibly checked for venereal disease. And this applied to certain towns which were ports, where sailors, soldiers were often stationed, because this was the height of the British Empire. And venereal diseases were the biggest loss of days for soldiers in the British Army. And so rather than telling the men, you know, maybe keep it in your pants, they started to make sure that the women couldn't infect the men. So the idea was that you would take the women, you would check if they had any signs that looked like they may have syphilis. Then they would have to go into a lock hospital for 3 months.
And this is legislation. Let's just clarify that.
This is legislation. This is law.
Horrifying.
If you refuse to be inspected, then you would go to prison with hard labour. And again, remember that to be suspected of prostitution, that could just be being out alone after dark or being in the wrong area. And as we've said, we're in deepest, darkest Edinburgh at the moment. It gets dark here about 3:30 at the moment. So, you know, that's a very short period of the day when you can actually go outside as a woman. In 1866, they actually extend this further north. And in 1869, they pass a new amendment which says that the amount of time you can be shut in the lock hospital can be up to 1 year.
Oh, that's awful.
Yeah. And in Scotland, we have evidence of women writing to protest this because there were a lot of people who were protesting that this was going on. And there was a woman called Josephine Butler who she actually said that the Contagious Disease Act amounted to surgical rape.
Mm-hmm.
And her campaigns were one of the things that were instrumental to the Contagious Disease Act being repealed in 1886.
Thank goodness, Josephine.
Yeah. Lock hospitals still carried on after that, though, and into the 20th century.
Into the 20th century?
Into the 20th century.
Gosh. So that is horrifying. So in parallel, are people developing a better understanding of syphilis, better treatments? At what point does somebody go, do you know what, let's put the Mercury down?
Well, I mean, this is, again, really interesting because we have, while the women are in the lock hospitals, one of the main places it's seen in men is in the asylums, because a lot of men develop neurosyphilis. That can present itself either as, you know, if it's gotten into your spinal column, you get what was known as tabes dosalis, which basically meant because it's destroyed your proprioception. Proprioception means the way you understand where your body is in the world, that you can't walk in a normal fashion.
So you don't have any understanding where your legs are?
You don't understand what your legs are doing.
Okay.
So it gives you this unusual, very characteristic gait. And of course, if you're walking a bit unusually, you're not aware of if you're doing yourself any injury, then that can lead to further damage. And this could lead to something which was known as Charcot's joint, which was again thought very, very characteristic of tabes dosalis. And we have a few examples of that in our collection here. If it was getting into your brain, this could lead to psychosis. It could lead to what we'd consider clinical depression today. It would lead to things where you would get sort of moments of grandeur, delusions of grandeur, followed by crushing despair. And over time, that could develop into apathy, seizures, eventually into coma. And so this was often being seen in asylums. And this is when they start to make the connection, because for most of the 19th century, there are these people who are suffering from tabes dosalis, and these neurosymptoms were described as general paresis of the insane. And you'll see this in a lot of asylum reports. But they weren't connecting that because of that latent period to that chancre that you had 15 years ago. So it's only in 1876 when a neuroscientist from France called Albert Flanier, he makes the connection. You know, he's talking to these people, he realizes that a lot of them had that chancre. early on. And he starts to make the connection.
And that chancre is known to be syphilis, so he knows that.
He knows that.
So it's interesting because you're talking about sex, right?
Yeah.
you have to have the nous and the ability to say, to be able to talk to patients about their sexual history.
Yeah.
Then.
Yeah. And again, you can see that that's how different that's going to be for upper class women who may get syphilis because it's been brought back by their husband, but you're not going to diagnose that in that way. And we have a few examples of that here, that we have reports of women who it was said that they had tuberculosis or something like that. And it's only when they have an autopsy after death that they realize that actually that was syphilis all along. But yeah, when you get into the 20th century, that's when we start to get more understanding of what the disease actually is. So we actually establish what Treponema pallidum is. You start to understand that this is the bacteria that causes syphilis. That happens in 1905. And then just after that, we get the Wassermann test, which is actually a test which can say, this is syphilis. This is not something else. We can actually determine that you have syphilis.
And this is early 1900s.
This is 1906.
Okay.
And then in 1910, we get a cure.
A cure?
A cure, and it's called Salvarsan.
Okay.
And it's developed by a German scientist. Now, we've had all this problem with Mercury. Salvarsan does cure syphilis.
But what was it, arsenic or something?
It is exactly that.
It is
arsenic.
I actually guessed that. Amazing.
And effectively, it's almost like a sort of chemotherapy type approach. You're hoping that you will kill the syphilis before it kills you.
Okay.
But of course, you're getting exposed to arsenic at the same time. And the thing about Salvarsan was that the treatment was very, very unpleasant. And it wasn't just one dose. You had to have repeated treatments. So people would often have the first treatment, feel awful, and not have the further treatments that would actually lead to it being cure.
And is it a lotion, a pill? What am I doing?
It's I think it was a pill.
Okay.
I'm not 100% certain about that. But it was certainly not pleasant to take. And there's still recognition that we don't understand exactly how syphilis progresses. How does it go from that chancre through to these other manifestations? And so good scientists decide what you need to do is figure that out. Do some tests to figure out how the disease progresses. And so that's why you get, in 1932, the Tuskegee syphilis experiment. And saying it like that might make it sound like that's a good thing. You want to understand the disease, right? Everyone wants that. If I tell you that the official name of the experiment is the study of untreated syphilis in the Negro male, this might give you an impression of how this is actually going to play out.
Yeah, that's the official title.
That's the official title. It's a horrific start. And effectively what they did was they recruited 600 Black American sharecroppers in Tuskegee, Alabama. They were told that they would get free medical treatment, free food, free burial insurance if they would take part in this trial for 6 months.
600 men.
600 men. 399 of them had syphilis. 201 did not. So again, a control group as well. That was meant to be for 6 months. It lasted for 40 years.
So it stopped in the 70s?
In 1972. That's horrific enough. As I said, this is untreated syphilis. And what we've got to remember is that in that time, in 1927, we discover penicillin. And there are problems. The bactericidal properties of penicillin are recognized quickly, but trying to get it to mass produce penicillin is quite difficult. So we don't really get that till the 1940s. And very, very quickly, penicillin starts to be used in the US Army.
And penicillin works, right?
And penicillin works. By 1947, it has become the standard treatment for syphilis in the US. It's rolled out to the general public. This is how we're treating syphilis. None of the men on the Tuskegee syphilis experiment were ever given penicillin.
So 1947, we're rolling out a treatment.
Yeah.
Which works for both the latent syphilis, right? The tertiary.
Yeah.
As well as if you just got it. So if you've just got the rash. But it is from 1940 to 1970, this experiment continues.
Yeah. And the experiment only ends in 1972 because of a whistleblower.
So was it a secret?
It was just one of those things that it was being done. That none of those men understood the rationale behind what was happening. They were just realizing that they didn't have to pay for medical treatment, that they were getting this. for free, that they were getting various, what they saw as benefits, but they didn't understand what the problems behind it were.
And that burial insurance as well. Also early on, that idea of being invited to take part in an experiment for a hot meal. You just start to realize how important, like how enticing that was. It's so hard for us to understand today, but...
Yeah, absolutely. And of the men, those 600 men in that experiment, 28 die as a direct result of syphilis, 100 from complications of syphilis, 40 of their wives were infected.
I was about to say, are they not married? Are they not having lives?
And 19 children get congenital syphilis. And again, there was something that could have been done.
So it's publicly exposed, thanks to the whistleblower, and then shut down?
Yeah. Mm-hmm. And compensation was paid to the men.
It's such an incredible example of just completely dehumanizing people into a data set.
Yeah, absolutely.
Completely horrific. So, Kat, penicillin, is that what we still use today?
Penicillin is still a frontline treatment for syphilis. Of course, you're now getting problems with antibiotic resistance. And syphilis, the numbers declined hugely because of penicillin.
Okay.
But now they're on the rise.
So it's on the rise. So what's happening today?
Well, there are a number of things. I mean, first of all, there is that degree of antibiotic resistance. Secondly, one of the things that drove a decline in syphilis was AIDS, and HIV. People were starting to use more protection on having sex. Of course, nowadays we have better treatment for HIV and AIDS, so people are less cautious sexually in terms of using condoms, that kind of thing, with new partners. There's also Viagra. Viagra is driving increased sex amongst older people who don't have protection because they're not worried about pregnancy, that kind of thing. And so there is a number of people in that older group that are getting syphilis today.
Wow. So the increase in unprotected sex.
Yeah.
Coupled with immunity against antibiotics.
Yeah.
So given that it's Valentine's Day, what should we do today?
If you have any symptoms that you think might be syphilis, if you may have had anything that puts you at risk, go and see a doctor. It can be treated, things can be done. The earlier you do it, the better. The less chance of long-lasting damage and the less chance of you exposing other people to syphilis in the meantime.
Yeah, I think see a doctor is very, very good advice. And not being embarrassed to talk about these things.
Absolutely, yeah. It's not talking about things is undoubtedly one of the worst things we can do.
Yeah. Well, thank you so much for joining us, Kat. Happy Valentine's Day, everybody. And remember to keep talking about sexually transmitted diseases.
Thank you very much, Chanté.
Thank you for listening to Beyond the Knife, a medical history podcast brought to you by Surgeons Hall Museums, Library and Archives. To find out more about us, you can visit www.museum.rcsed.ac.uk. You can also follow us on our social media channels. Join us wherever you get your podcasts.